Okay, welcome back to the show. There are so many medical breakthroughs over the last few decades that it's sometimes hard to keep track of all of them. Advancements in medicine, cardiac care, cancer research, and so much more are on our minds on a daily basis that sometimes we overlook the biggest health necessities, one of them being stem cell therapy. Well, tonight we have a specialist whose offices are right here in Clifton and tackles that exact issue. So I'd like to welcome Dr. Douglas Spiel to the show.
Once again, thanks, Doc.
All right, thank you, man. Thanks for having me.
Thank you. Dr. Spiel, a stem cell, anything stem cell almost just sounds sci-fi to me and most people, because I know it's relatively new, maybe not for you, but in society. So maybe just explain what are stem cells and how does therapy work?
Sure. Stem cells are essentially the building blocks of every other cell in your body. They have the ability to turn into many other different cells, and they themselves regenerate. Those are the qualifications for stem cells. They turn into your heart, your lungs, your liver, your skin, even your brain and spinal cord. The beauty is that we have a lot of these resident stem cells throughout our bodies, but when we're first born, they are ubiquitous. They're everywhere, they're vibrant, and they're robust. If you've ever cut the skin of a small child, you'll notice that within a day or so, you can't even see it.
Right.
Small children regenerate. We go and shave ourselves, we get a cut, now we have a line. We repair. As we get older, we lose the ability to regenerate, and unfortunately, we repair more. Stem cell therapies allow us to regenerate more.
Okay, before I get any further, I need a little bit, what's your background? Because that would be helpful.
Sure. So I was myself a radiologist.
Okay.
And in about 2000, I started doing interventional pain. So interventional pain is a way to ameliorate pain through the use of needles and catheters. I do endoscopic spine surgery, and I do many different things to access many different cavities throughout your body. When I started learning about the cellular biology of stem cell therapy, I realized that I was uniquely able to treat many of the maladies. I can find my way into the central nervous system.
Right.
I can go into joints. We can certainly access the intravenous portions of your body. So we're able to deploy stem cells in a myriad of different ways to treat a myriad of different illnesses. So what are some of the illnesses?
Well, that's what I was going to ask you, because what are conditions? 'Cause stem cell, it could mean anything to me.
So
what would we treat?
Simple things from our hair.
Okay.
COPD, chronic obstructive pulmonary disease. Musculoskeletal diseases. I have a problem with my rotator cuff, doc, my meniscus and my knee. We can treat autoimmune disease, so whether it's rheumatoid arthritis or ulcerative colitis or even thyroid disease. Neurodegenerative problems, people with MS and Alzheimer's and spinal cord injuries, people who have cardiomyopathy and have injury to the heart with scarring after heart attacks.
So we come to your center for a treatment, and we'll get to that, but what are the treatments like? Is it shots? Is it Band-Aids?
So let me explain some of the things that we do a little bit differently. So with stem cells, we're harvesting mesenchymal stem cells from you, for you. That means we access your fat, your adipose. We can take stem cells out of there. We can access your bone marrow and take stem cells out of there. But we do things a little bit differently here. At Stem Cell Center of NJ, we don't just take your own stem cells. Your own stem cells, if I access your stem cells from your fat, you're like me, you're 52 years old, your stem cells are 52 years old. So my point is that even my stem cells, I take care of myself, I try to eat right and all those different things, my stem cells are not as robust as when I was born. When I was born, they produced 4 times the amount of growth factors they do now. If I take them out of your fat, or I take them 2 ounces of fat from myself, I might get 100,000 stem cells.
Right.
But we add something. So I am the medical director of Chimera Labs in Florida.
Okay.
And at Chimera Labs, we have placental-derived stem cells. That means that we take donated fetal placental tissues, we pick out the stem cells, and we grow them. And we collect the juice. Why is the juice important? Because if I take your fat and I put it in your knee, and I go back 3 months later and you say, Doug, my knee feels great. And I look for those stem cells in your knee, they're not in your knee. They go to your liver, your spleen, your lungs, your bone marrow. But why is your knee better? Your knee is better because those stem cells give off little packets of information, little blueprints.
Right.
Those are known as vesicles or exosomes. Well, my vesicles and exosomes come from stem cells that are 52 years old. But from our lab in Chimera, We can get the stem cells, exosomes, from newborns. We can take a 1 or 2 cc aliquot of fluid that contains 10 or 15 million stem cell products, compared to the 100,000 that I could take from your fat. So now I'm delivering a better punch.
Right.
And if the ability to regenerate tissue is what we're trying to do, more is better. Now, it's illegal. The one thing I didn't say, it's illegal in the U.S. for me to take your cells and replicate them,
right.
2, 4, 8, 16, 32, and put them back in. And I can't take his stem cells and give them to you. But I can take the stem cell products, add them to yours, and deliver them to you.
Okay. So what I'm hearing here, is this fountain youth or better quality of life? Because it almost sounds like we're creating a whole new person, or we have the ability to.
It's funny you ask me that. There's a couple of companies on the West Coast who are exploring the fountain of youth concept. And what they're actually giving is plasma from younger people to older people. And in that plasma is very dilute exosomes. But those are from 20-somethings.
Right.
My exosomes are very concentrated, what I get from my lab, and they're the most robust cells they come from that you can put your hands on. So it is a fountain of youth in many respects.
Okay, well actually, at least a better quality of life.
Certainly.
So actually, for us to better understand this, just give me an example, 1 or 2 examples of something you've treated and made better.
So people have a high affinity for the professional athletes.
Okay.
One of our lovely success stories is a young man who couldn't play anymore due to pain in his low back for 6 or 7 years, couldn't shoot jump shots, really couldn't bend over and tie his shoes anymore. 4 months after stem cell treatments, he's now playing in the NBA. We have patients that come to me with spinal cord injuries. One such patient's coming back again next week. He had a C5-6 spinal cord injury. Couldn't walk, and he was catheterizing himself because he was incontinent. After a number of treatments now, he's no longer incontinent, and he walks 200 yards with assistance.
Okay, so those are some success stories.
There are some robust success stories.
I know this is a short segment. There's so much to offer. Just briefly, can you, if they wanted to research this, are there websites they could check into this?
Sure. So I lecture nationally for Boston BioLife. Stem Cell Center of NJ is the website. So stemcellcenterofnj.com.
Right, I have that.
And we have informational videos. We have discussions about the cellular biology. You can seek out the literature and download some papers that we have available. So there's a lot of ways for you to educate yourself before you come in.
Okay, well, this is certainly the future of medical helping people, so that's a great thing. Doc, I'd like to thank you for coming on. Hopefully you can come on again. We could get more involved and talk a little more in depth.
Listen, I appreciate it. This is going to be to our generation what penicillin was to the one before.
That's great. Thank you very much. Stay tuned. We'll be right back.